Well, welcome everyone. We're going to get started with our afternoon program on our COVID-19 Houston Business Forum series. We're featuring today Dr. James McDeavitt from Baylor College of Medicine. Just give us a moment for everyone to enter the program today and we'll get started. Again, thanks for joining us today for our Partnership Business Forum on COVID-19. Thanks so much for joining us. A lovely day outside today, but we're glad that you joined us for this afternoon session. Just very quickly, I want to point out that all of the resources from our webinar series are available on the Partnership's website at houston.org/coronavirus. And we are actually using this kind of as a main one-stop shop. So you can also find other information there, including resources on recovery, reopening for small businesses, and economic updates as well. We're recording all of our webinar sessions, so you can find those also on this site. And I'll just give everyone a second to either write that down or take a quick snapshot. But again, we'll visit that URL here in just a couple of minutes as well. I just want to point out a couple of resources that you will want to be familiar with that are very recent. We understand there's this growing need for more information related to returning to work, and today you can find our most recent report titled Reopen Houston Safely. This document is the result of the efforts led by the partnership and also informed by about 70 of our business and community leaders who served on one of our industry-focused working groups. This is a very recent report. We just put this out about 2 days ago. The partnership, in association with this report, we will continue to update it. We'll continue to have webinars such as these. And we're also going to be starting a series of webinars that are more industry specific about reopening. So be on the lookout for those notifications for those meetings. I did want a quick disclaimer on some of the resources, or all of the resources the partnership's putting out right now on COVID-19. We are working with the community to share best practices and information through all of our communication channels. This information is intended for general information purposes. And not necessarily for, or should be interpreted as legal or entity specific. So we just advise that you consult with your legal, HR, and tax representatives on specific questions about your business or your employee and employment workforce related matters. So let's go to a couple of protocols along the way that we're going to be conducting today's event, very similar to our other events. On your toolbar, if you take a look at your toolbar, you can see the chat feature. Please use that feature if you have any technical issues or you need to ask questions of our behind the scenes staff or comments. But we are using the Q&A tab that's featured on your toolbar for questions specifically for our speaker today. So if you could pose any questions you want answered for our speaker on the Q&A tab, not the chat feature, that would be helpful. And as time allows, we'll be going through those questions at the end live, or they will be answered in text version. You can also use the raise your hand feature. That'll alert our staff also behind the scenes that you're having some kind of difficulty or you do have a question that we have not been able to answer. So we'll try to answer those questions in privacy mode. I'm going to turn things over now to the head of the Marketing and Communications Department at the Greater Houston Partnership, Clint Sachet. Clint's going to take us through some of the partnership activities in association with Reopen and also introduce today's speaker. Clint?
All right, thank you, Carrie. I appreciate it. And I apologize to the viewers that the yard people across the street decided to grind a tree right now. So if you hear that, I apologize. But thank you. And I'll introduce Dr. McDeavitt in just a moment. But did want to talk through a little bit of what the partnership has been focused on over the last several weeks. And Carrie mentioned some of the resources. This is all about reopening safely. And if you saw our op-ed by Bobby Tudor, Mark Watts, and Bob Harvey in the Chronicle this Sunday, you know, the business community has been given a great responsibility to reopen safely. And so we've been focused over the last 3 or 4 weeks in building out those resources, talking to business leaders from around the community, curating the best resources that we can find to help you as business leaders, business owners, create a safe environment for your employees and your customers. Neil, I mentioned we convene business leaders. We actually set up 8 industry working groups that had 70 business leaders, and I would say it's small businesses to large businesses. And in that report that's on the screen, actually mentioned there, we actually have the names of all those companies. And we also surveyed, there's about 850 businesses across the Houston region responded to that. So, you know, we were looking at things you were concerned about and issues and tried to address those in these plans and the resources that we put out. Obviously, this has accelerated in the last week and a half following Governor Abbott's order on April 27th to reopen, I would say, businesses that had been previously shuttered. You know, one unique thing about Houston is about 60% of our companies were considered essential businesses. So unlike some other regions in the country, we've actually had a lot of our businesses kind of figuring out, I would say almost on their own, how to operate safely over this entire pandemic time. But on April 27th, and that week following Governor Abbott's order, we did reissue our WorkSafe principles. We went from 10 principles to 15, and you can find those at houston.org/worksafe. And these are just common sense practices that as business leaders, you put these into your planning process as you're thinking about reopening. That WorkSafe page also now has all of the governor's guidance there. I would note that he did issue a new order earlier this week and updated a lot of that guidance. So if you looked at things from a couple of weeks ago, it's probably worth either going to the governor's page, or again, you can find it at houston.org WorkSafe. And he has guidelines for several different sectors and updated guidance that he had previously issued. And so, you know, as we were doing this work and curating the best resources we found, we were quite grateful to Dr. Paul Klotman, who's the president and CEO of the Baylor College of Medicine. He sits on our board and emailed us actually earlier this week and made us aware of the work that Dr. McDeavitt's team was doing at Baylor College of Medicine. And really what they've done is built a wide-ranging, but I would say concise guide on the key issues that businesses should be thinking about. And again, there's so many great sources out there, but when we looked at this one, it was one that we needed to get out on a webinar as quickly as we possibly could. And you know, the great thing about it too is it's coming from a trusted institution, Baylor College of Medicine. So you know this is the right thing, and so I'm excited to hear his presentation and get some of your questions answered. Just to quickly introduce Jim, Dr. McDeavitt, he currently serves a dual leadership role. He's the Dean of Clinical Affairs at the Baylor College of Medicine and also serves as the Chief Clinical Integration Officer for CHI St. Luke's Health System. And I would characterize his responsibility across all of those things as it's creating linkages between physicians and CHI St. Luke's hospitals, between Baylor educational programs that they're so well known for in the communities in need of healthcare providers, and between cutting edge research programs and the bedside. And that's what Houston is all about, is taking that research and giving it to the clinical setting. And you know, in this case today, it's all about linking businesses with science-based, well-researched guidance for reopening safely. So with that, I'll turn it over to Dr. James McDeavitt, who will walk us through his presentation, and then we will open it up for questions after that. Thank you.
Very good, Clint. Thank you. And you can hear me okay?
Yeah, sure, good.
So I'm going to attempt to share my screen. Can you see Guide to Reopening Business?
Yes, we're good. Thank you.
Good. So we put this together in part, and I appreciate Carrie's legal disclaimer to start this off in terms of who's an expert in reopening businesses. I have a confession to make. This is my first global pandemic. So I'm not sure I can profess any expertise beyond a lot of other people on the call who have done a lot of this by trial and error. We, Baylor, are a large organization, and much like many of the people on this call, about 12,000 employees. We are diverse in our mission, and we've got a large clinical operation. So we have to take care of patients and customers. We have a large educational enterprise, and we have a very large research enterprise and basic science laboratories. So a lot of complexity and diversity to manage in this environment. And we've had to maintain continuity of business operations, as many of you have as well. So that's how we're maybe the same as many of you. How I'm a little bit different, or what I feel very fortunate to be in this position, is I've got a ton of people in terms of human capital that are actually smart, thoughtful, knowledgeable folks that know things about infectious disease and epidemiology. So as we've taken general guidelines, opening guidelines, and filtered them through our really good people, we try to develop things that are actually practical and digestible. Increasingly important, and this is hard, and to make that point, if you've followed the news today, the most recent news item is that the CDC has developed business opening principles that I think you can still find on their website. There's 17 pages of them. And the administration just announced that they were not going to release nor support those recommendations. So this obviously is not something that anybody has completely figured out. I take a minute to introduce Jessica El-Halal, who's on the phone. Jessica helps to run our business development and strategic planning functions at Baylor and put together a lot of these materials. And Robert Falabine is our supply chain expert, because I know there were a number of questions around supply chain. So with that introduction, I'll run through a few of these slides. And again, these are fairly general, but as you are looking at your businesses, I think first of all, think about your employees, how you're going to manage your employees, how you're going to maintain a safe environment at work. And some of these things obviously are obvious to everybody, but and some are maybe not so obvious. The staggering of hours, what you're trying to do is not have everybody show up at the same time and congregate and not have appropriate social distancing. So one way to affect that is to have people start and stop at different times, maybe stagger your start times over an hour so people are coming in at different times. And then I think a really critical time that people tend to miss is lunch and break times. So you may have people that are really adhering scrupulously to social distancing when they're out in the showroom or in the lobby. But when they get back in the break room to have lunch with their friends and colleagues, the masks come off, they're sitting 2 feet away from each other, and it goes out the window. So I would encourage you to walk your environments and particularly look at areas where you're at risk and that you might lose that social distancing. At Baylor, one of those areas is auditorium. We have a ton of auditoriums around the organization, and what we've done is gone through each of those auditoriums. We figured out how far apart the seats are, and we've marked with the red X all the seats that we don't want people sitting in, and with the green arrow all the seats that we do want people in, so we maintain social distancing. That's just an example of walking your environment and trying to be creative about how you're maintaining social distancing. I think another important point is, and probably a critical point, is daily health checks. I think as you're bringing employees back into your environment, it's really important that you are checking or having somebody attest or having employees attest on a daily basis, and I'll show you this information a little bit later, having them attest that they are asymptomatic, they don't have fever, they don't have cough, they don't have an increasingly large number of CDC symptoms we'll go over in just a few minutes. And I think in the ideal world, you would actually monitor people's temperatures when they came into work. And again, your goal is to not bring sick people into your environment. So I think that's critical in terms of maintaining a safe work environment. In terms of supplies, I think there are a lot of questions around supply chain and can you actually find these things? And there's nothing radical about this particular list, but these are things that it would be good to have on hand. You might not have thought about no-touch trash cans, but a good idea. I would caveat the issue of gloves. And even pre-shutdown, I would go to restaurants in Houston and the table busser, the waiter or waitress would be wearing plastic gloves. Always makes me a little bit nervous. Plastic gloves aren't really any safer than your bare hands if you're not changing them frequently. So if I have contact with a patient, I have to wash my hands between every patient. The fact that I have gloves on doesn't mitigate my need to wash my hands. So if you are going to use gloves, be careful that the use of the gloves, you're just putting on a second skin. So if you're moving around the environment and touching things, you're touching them with the plastic rather than your skin, but you're still contaminating the gloves. So be careful that if you're using gloves, that you're changing them at an appropriate frequency. And two, make sure that people don't get a false sense of security because they're wearing gloves. They think, well, they don't have to worry about hand washing anyway. Hand washing is 90% of the battle. Gloves might help to augment that at best. For those of you, I guess most of you, that have people come into your business, your patrons, your visitors to your companies and organizations, think about the controls that you have when you have people coming in. And one important thing is you're controlling your employees coming in. Do you have a cough, fever? Are you sick? Are you doing the same thing for your visitors? And significantly, think about your vendors. You can develop a really tight process for your internal employees in doing symptom monitoring. And then the FedEx guy comes in, who's been who knows where, doing who knows what. And I'm not picking on FedEx, just using that as an example. It could be the gas supplier, the food supplier, or anybody else you have coming in to deliver things to your site. Think down the supply chain when you have human beings coming into your organization. What infection control processes are they using? How can you hand off those materials while minimizing physical contact? Kind of like DoorDash will leave your dinner out on the doorstep and ring your doorbell, and you can pick it up with actually seeing the guy. I think they're analogous sort of situations to look at in your internal deliveries in your business. And I think also importantly, being rational about how many people you can put through your business. Now, the governor, I think, somewhat arbitrarily said, look at whatever you're rated for, and we'll start at 25%. That's probably not a bad start, but utilize some common sense, walk your environment, and think about how many people can you, again, reasonably pack into that environment. In terms of facilities, we'll talk some about cleaning, but again, the cleaning is not hard. The virus is not difficult to kill. It's just a matter of being very meticulous and consistent with your cleaning practices and probably having some degree of increasing frequency. Something many of you, I'm sure, have thought of is having soap or disinfectant available at entrances so your patrons can sanitize their hands as they walk in would be useful. I've seen a number of businesses, and we do this actually with our auditoriums in Baylor, limiting the entrances that people can use, and increasingly if you can change the flow. So we have rooms set up where you go in one door and you go out the other door. Ordinarily you can go in and out either one, but to the extent you can maintain one-way flow, I think helps to keep people from crossing each other and getting too close. I've seen some stores that have actually set up one-way aisles, put arrows down on the floor, and establish the flow through the store. Some stores like IKEA already sort of is designed this way, that you go to IKEA, you've got to walk the entire IKEA store and pass everything, not for infectious control purposes, but so you see all their merchandise. But that also keeps you moving in the same direction of other people. So can you redo your flow in your businesses so everybody is moving in the same direction? And anybody who's been to a grocery store has seen the salad shields they set up between the cashiers and the customers at the checkout line. Well, we set up those same lucite shields at all our desks. So when you're checking in with one of our people for a medical appointment, you have that physical block from between your employee and the customer. So a lot of thinking to do about facilities. The issue of cleaning surfaces, again, not hard to clean. If you go to the materials that are linked on the website, you can follow that link and see a list of approved cleaners. But virtually any cleaner effectively disinfects the virus. Again, it's more an issue of doing it consistently and doing it thoroughly. in terms of soft surfaces, cloth surfaces, generally just laundering them appropriately is adequate to adequately clean the virus. We took a pass at thinking about, well, the business of running a school, the business of taking care of patients is different than a restaurant or a gym. So we put across the top of this slide things you ought to think about. So, I mean, are you going to require masking? I think now you probably are, but if you notice we left that empty for fitness, for gyms, because can you really go into a gym and exercise vigorously and wear a mask comfortably? I think the answer is probably not. In that case, as a gym, you might have to think more carefully about how you're maintaining social distancing. Maybe 6 feet is not enough. Maybe you need 10 or 12 feet of space between people that are exercising, and pay real scrupulous attention to that. Whereas if you're masked appropriately, the distancing may not be quite as important. I think everybody, without exception, is going to have to think about maintaining physical distancing. Everybody is going to have procedures for how to manage people that get sick. And as I think most of the people on this call know, they're not out of the woods by any stretch of the imagination. We still have a population out there that the vast majority of which have not been exposed to the virus. And as we start to open up Houston, and as people with the virus start coming in contact with other people, it will spread, and I fully expect we'll get another peak, which I hope will be small, but we will get a peak. But we're going to have to continue to manage the sustainable social distancing, and we're going to have to continue to take care of people that are exposed and sick, including our employees who will get sick. I think it's not if they get sick, it's when they get sick. Cleaning, monitoring symptoms, appropriate PPE, I think are probably obvious. And then alternative business models. Can you do what you do in a different way without face-to-face? Or can you do, as most of the restaurants are doing very well now in Houston, can you offer this at a to-go basis? So make sure you're thinking through those buckets in terms of your business and how you might choose to do things a little bit differently or more creatively. Something I think is important that I've seen missed in many cases is how do we make people feel safe when they come back? And when you look at, we've been sort of locked down now for over a month. There are going to be different sorts of people that start to come back out to open up Houston. They're going to be the people that either have such critical needs or are just so confident that they'll be early adopters. They'll be back in your stores and businesses tomorrow. There are going to be some people that are so terrified that they're going to stay locked in their rooms until there's a vaccine available, and you may not see them for 18 months. I think it'll be a relatively small number, and for really at-risk people, that may not be an irrational choice. And I think there's going to be a large group in the middle that are going to kind of wait and see and ease into things as they get more comfortable. So in terms of rebuilding business, I think it's really important to communicate to your consumers, how are you keeping them safe? What have you done as an organization to ensure their safety? All this creative work we've talked about now, looking at your business and thinking about one-way traffic flow and how you're taking care of your employees, will tell that story to people so they feel comfortable when they come in to see you. We've done that at Baylor. We've got a statement that gets pushed out to patients in advance of a visit. It gets pushed out through their electronic medical record, and increasingly we're looking at a way to communicate to the people to say we are probably among the safest places to come right now because we've been at this for so long and thinking about it for so long. So do what you can to make your customers comfortable. The next couple slides get a little bit dense, but it's important information. And I think really critically important to think about what happens when somebody develops symptoms or somebody actually develops COVID-19 in your business. What do you do with them? And most people, small businesses won't have an HR function. A lot of big businesses won't have an HR function that is adept at dealing with a global pandemic. So we've tried to take these are actually what Baylor does, and we've tried to simplify these so they're more generally applicable across the different businesses. Highlight just a couple of things I'll come back to in a second. One is the issue of self-quarantine. Should I self-quarantine? oftentimes the answer to this question is going to be yes, and I'm going to get to a slide in a second that talks about what quarantine is. And then these last two columns, should I contact my primary care provider, and when can I come back to work? I think it's really important that you have clarity of thinking when you're faced with somebody who has symptoms or somebody who is sick. You really have two issues to deal with. You have someone who's sick. They need medical attention. They should be contacting their doctor, their primary care doctor. And you have a HR issue that you've got to deal with, an exposure in your workplace and an exposure potentially to your other employees. That's an HR function. That's an occupational health function. Don't muddle the two. If someone's sick, they need the doctor, and then you need solid policies and procedures for how you're dealing with exposed people in your environment. So to walk through a few of these, the symptoms of COVID-19 are there listed. I won't read all of them, but it's cough and shortness of breath or difficult breathing. You have to have those things, or any two of the rest of those things on the list, including loss of new taste or smell or shaking chills. I will tell you these change somewhat frequently. They changed a week ago Saturday, and these are CDC, based on the CDC guidelines, and they changed 3 or 4 days later. So we monitor these, we update this based on what the current symptoms are. So if I develop symptoms as an employee, the way you read this, should I continue to work? No. Should I stay at home? Yes. Should I self-quarantine? Yes. Should I wear a cloth face mask? Yes. And spoiler alert, the answer to that question is always yes. Everybody should be wearing a cloth face mask at this point. And then should I contact my primary care physician? Well, the answer to that question is yes if you're sick. A lot of people with COVID-19 have a mild cold and don't really need to seek medical care. But if they're having significant symptoms, if they feel like they're sick, if they're getting worse, then by all means contact your primary care doctor. Or if they're critically ill, go to an emergency room or go to an urgent care center. But as much as possible, we should try and stay out of institutions. If you're not sick, then you can contact your primary care doctor and get guidance. And then we'll come back to what a company protocol might look like in just a second. I think important is this next point is not so much the symptoms that take you out of work, but what kind of symptoms can you stay at work? And if you have a runny nose and seasonal allergies, which few people in Houston do, and it's just like your seasonal allergies you get every year, and you take an antihistamine and it gets better, that's not COVID-19. If you sneeze, that's not a symptom of COVID-19. So make sure you're not over-interpreting symptoms and taking people out of work needlessly. For seasonal allergies and sneezing, that's a healthy person. They should be wearing a face mask like everybody else, but they should absolutely continue to work. Travel restrictions in the next box. This is really mandated by the governor's order at this point, and it's footnoted. You can see the up-to-date list. Now, when this whole thing started, it was Iran and Italy and South Korea and China. And then it expanded to New York, New Jersey, Miami, Chicago, Michigan, and until recently, it was Louisiana. Louisiana has come off the list, happily. But if you've been in any of those locations by governor order, then you have to self-quarantine for 14 days upon return to Texas. So that's sort of a special case for travel. At Baylor, we have prohibited all professional travel, and it's a big part of what we do is travel around the country to conferences and meetings and such. No professional travel for now. We have discouraged personal travel, particularly personal air travel, although we really can't mandate that as an organization. Next box down, have you been in close contact in the past 14 days with somebody who has confirmed COVID-19? So you will see this. You have a employee whose roommate tested positive for COVID-19. They had casual contact with somebody from COVID-19. In this case, at this point, we're actually recommending, if it is a close contact, that you probably should take that employee out of work until the virus is under better control. Stay at home, self-quarantine, and we'll have a conversation in a second about whether you test or don't test. And then lastly, have you actually been diagnosed with COVID-19? You've gotten the test, and the test has come back positive. Well, obviously, you should not be working at that point. You should stay at home, self-quarantine, wear a mask, see a doctor if you're sick, and then follow your company protocol that we'll talk about in just a just a second. So of all the slides in this deck, that's probably the densest of the slides and probably has maybe the most useful information that you will have difficult finding in another source. A couple other issues. One relates to, we keep telling people to home quarantine. Well, this is advice we give our patients when we home quarantine. Again, they're mainly common sense ideas, but home quarantine does not mean you have to go check into a hotel and stay away from your family. It does mean you need to distance yourself from your family, sleep in a different room, keep separate clothes and dishes, and keep things separated until you're recovered. But again, home quarantining from the time you develop symptoms is a really important strategy to control the disease. Related to sort of, I've just got a couple more slides to go through, and then we're going to open it up for questions. But you have somebody now on that exposure slide that I showed just 2 slides ago, and say they've tested positive for COVID-19. Well, how long do they stay out from work? And do you need to test them before they come back from work? And before I talk about that, let me address what I know will be a question, because it's the most common question I get. Should I test all my employees before they come back to work? We've been listening for 2 months about how testing is inadequate and how testing is critical to being able to reopen safely. Well, what should we do in terms of a testing strategy? I'll spend just a second on this because it's important, and as most of you have probably read, there are actually 2 tests when we talk about testing. The newer test is the antibody test. That's the one where you're exposed to the virus. Your body reacts to that exposure by creating antibodies that are specific to that virus, that we can then measure those antibodies and know you were exposed because your body reacted in that way. Very much if you develop measles, you'll develop measles antibodies. The difficulty with the antibody test right now is there are a ton of tests out there. They developed a bunch of them in China that are of variable reliability. So you're not exactly sure what you're getting in terms of antibody tests frequently. There are a lot of problems with cross-reactivity because the coronavirus is in the same family of virus as common cold virus, for example. If you take the serum of a patient and test it for antibodies and they've had a cold, you tend to get a lot of false results that would indicate that you've been exposed to coronavirus when you really haven't. So you might get a false sense of security or a false sense of alarm based on the results of the test. And lastly, we don't yet know what having antibodies means in terms of your immunity from the illness. So it's highly possible, and we've had some evidence that people have gotten reinfected, that you could have antibodies and still get reinfected. So Baylor's view of this right now, Baylor has developed its own antibody test. Baylor is validating that test to address all the issues I just referenced above. But as of right now, we are not recommending antibody testing as a routine part of a return to work strategy. We don't think the science is there. And again, changing the situation, that might be different a week or 2 or 3 from now. So stay tuned. But right now, I do not recommend antibody testing for return to work. Different question is diagnostic testing. These are the famous nasopharyngeal swabs in the testing centers, the so-called PCR testing. This is a test actually looks for the RNA or the genetic material of the virus, and if you have it, then you have been exposed to the virus. A couple things that are important to keep in mind as a testing strategy. There is a hospital in Houston that tested randomly or tested asymptomatic people in the hospital, employees in the hospital, and physicians and caregivers, 535 people. Of those 535 people, they were all in high-risk environments. They were in ICUs. They were anesthesiologists that were intubating people all day, every day. They were in settings where you would expect if they were going to get exposed, they would get exposed. Of that 535, there were 2 positives. And we've seen that pattern play out whenever we've done surveillance testing in the community. There are just not that many people that are infected right now. So in a low prevalence environment, widespread screening of asymptomatic people doesn't make good epidemiologic sense. We probably should be screening in nursing homes and in prisons and in areas where we know the virus is likely to flare and where the prevalence may be higher. But right now, in a low prevalence environment, it doesn't make sense. Now, if we had a 20% prevalence, if 1 in 5 people in Houston were infected, it would make a lot of sense. Second issue is, let's say you open your business tomorrow and you manage to test each and every one of your employees before they go back to work tomorrow. What you've done is proven they don't have the virus at that moment in time. Saturday, they get infected, they come back to work on Monday, you're right back at it. So unless you're going to do surveillance on some sort of regular basis, that also doesn't make any sense to just look at that moment in time. It might make your employees feel more comfortable about coming back to work, but I don't think there's necessarily a scientific rationale for that. So what Baylor is doing related to testing is we are testing any employee that becomes symptomatic, obviously. We are testing close contacts to symptomatic people. Our environment's a little bit unique, and we are testing high-risk individuals, the people that are working, intubating patients, for example. And we're doing a very small sample, about 20 people a week, of sentinel testing to just randomly look in our environment to see if we have any of the virus. And I think that's a scientifically valid and fairly aggressive testing strategy at this point based on the science today. And so getting back then to the, it was a digression, but if you're making return to work decisions, you have to decide if you're going to use a symptom-based strategy to return people to work or a test-based strategy. And these are both valid choices to make. The symptom-based strategy is exactly that. You have to be at least 10 days into the development of your symptoms, and your symptoms have to be improving for 3 consecutive days. In that case, if you reach those criteria, 3 days since your fever resolved without taking Tylenol, and 3 days of improvement in respiratory symptoms, and you've been 10 days since your symptoms have disappeared, then you can come back to work. You have to mask then for at least 14 days total. That's sort of a moot point now because everybody's masking all the time anyway. So that's a symptom-based return to work strategy. A test-based strategy is much the same. You have the symptoms, your fever resolved, your respiratory symptoms resolved, and at that point then you can do 2 swabs separated by 24 hours, and if they're negative, then you can return to work. Now, why would you use one strategy versus the other? Well, if I had 1,000 employees in a service business and it was not a great hardship to send somebody home for 14 days until their symptoms resolved, and I can plug somebody into that role and fill it pretty easily, then symptom-based testing strategy probably works pretty well. If I'm leaner or if I've got critical employees that I really have to get back work as quickly as possible, then a test-based strategy might make more sense. But again, I think this is another really important slide out of the deck if you choose to download the PDF. And then lastly, the question gets asked, well, I want to get testing. How do I do it? And this is how you can access testing and how Baylor can help you to access testing if you were to choose to utilize Baylor. First and foremost, I would send people to the primary care physician. Any primary care physician can order the test today, and most of them should have the materials today to take the sample and then send that to a commercial lab. And the labs are widely available, and it depends a little bit on which lab you use and the flow in your doctor's office, how long it takes to get the results back. It might be within a couple of days. It might take a couple of weeks in some cases, unfortunately. An option would be you'd have to establish yourself as a Baylor patient, but in our new era of telemedicine, you can do that fairly easily. You can call our triage line, which is a COVID-specific triage line, and see a clinician virtually online with a video link, usually the same day, if not the next day. Do an assessment, decide whether or not you need testing based on your screening, and then we have a testing system set up, a collection site set up, appointment-based, pretty easy. And our testing, if you're tested in the morning, you get the results back that afternoon. If you're tested in the afternoon, the following morning. If you don't have a primary care doctor, I put some resources there to find one in the systems I'm affiliated with, and all the other big systems have ways of finding a doctor, obviously. These options get less appealing as you move down my list here, but you could certainly go to an urgent care. They should be able to take care of you. Again, if you're sick, I would try to avoid congregating in places with other sick people because we don't want the virus to spread. You're better off calling your primary care doctor than going physically to a place. And the worst comes to worst, you can contact the health department and they should offer testing for you. And then finally, we'll stop for questions, but just if you download the PDF, we downloaded the various sites that we pulled these recommendations and chewed on them and simplified them for your consumption. And we have a general email address available if you'd like to submit questions, have problems, happy to help. And with that, I'll pause and I'm happy to answer any questions.
Well, thank you, Dr. McDeavitt. I do appreciate that. And for those watching, I hope you do appreciate it. I mean, this is why we had Jim on here today. Good, just fact-based, science-based advice, and some of the things that we hadn't seen in other places or presented in a way that was pretty easy to understand. As noted in the chat, and we actually did put the link to this presentation on the Baylor College of Medicine website. So as he mentioned too, as CDC guidelines change, they're updating this. So continue to check back and find the most updated information. Have a number of questions coming in through the Q&A function. So if you do have questions, please put those there. Some of them we will ask live. And we also got some questions from folks beforehand. So I'll ask a couple of those now. You talked about low prevalence environments. I think one of the more interesting things that you talked through there is the testing that was done in the healthcare setting and came back with a very low positive test rate. So in a work environment, let's say an employee does test positive, who should get tested that's working around them? You mentioned close contact. How do you define, what does that look like in a work environment, and who should get tested?
Yeah, that's a good question, and it's a difficult question, unfortunately. And again, if you've studied the CDC guidelines, the definition of a close contact is nebulous and changing. But generally, if you're inside 6 feet and you're unmasked for more than a 30-minute period, that's probably a close contact. So it's both proximity and duration of contact. So on the other extreme, if you pass somebody in the hallway, even if you're not wearing a mask, that's casual contact. That's not a close contact. So there's some judgment involved between those two extremes. I'm sitting right next to somebody sharing their telephone, sitting at the same desk maybe for 30 minutes or more versus passing somebody casually in the hallway. Sure.
So several questions about face masks. Again, thinking about the common work environment, do I need to wear a face mask when I'm sitting at my desk? Should that be required of our employees, or I guess other areas? What's kind of the general guidance on that?
Yeah, first of all, we go to face masks. Question Mike had asked, we just differentiating N95s from surgical masks from cloth masks. There might be exceptions of people on the call where you may have to use an N95 or a surgical mask for some reason, but by and large, we should be using those materials for healthcare professionals, not the general public. I think generally in the general public, we're talking about using cloth masks. What the cloth mask does, the pores are too big to filter out viral particles, so it doesn't really protect you from the virus seeping through. What it does do is the virus tends to travel in aerosolized droplets, and the mask is effective at stopping those droplets. So if I sneeze, I'm wearing a mask. I don't spew droplets everywhere, and if I happen to spew droplets and you're wearing a mask, you're less likely to inhale them. So that's the reason why you wear a mask. If you're sitting at your desk, you're eating lunch, you're not within 6 to 10 feet of anybody else, and you're going to be there for an extended period of time, just like Jessica is back around the corner here, and she's way far away from me. You can take your mask off, that's okay. But I mean, your assistant walks in, she's bending over you, just be careful that when you start to get fast and loose with the rules, that you're being cautious and don't get be cautious. I think if you're in doubt, you should be wearing your mask. But take it off for lunch, socially distance when you have the mask off, obviously, and use good judgment.
No, thank you. So, a couple of questions on the cleaning protocols, and maybe we might bring Robert in on this one too. There's obviously a question of sourcing the materials or the cleaning products that has been an issue, and some very specific things. You mentioned cleaning upholstery and things like that. Are there more rigorous processes that folks should go through as they're thinking about opening offices? I've seen some recommendations on cleaning out your HVAC system. That's pretty pretty extreme. Like where is the guidance on that sort of thing?
Yeah, Robert, I'm going to ask you in just a second to comment on the sort of the supply chain issue, because I go to the same grocery store as you all do and go to the cleaning aisles, and they just you can't buy the stuff in a lot of places. I guess that's maybe improving to a degree. But in terms of general concepts, I mean, first of all, if you're in a room that has been vacant for the past 7 days, you don't have to sterilize anything. You can clean it, normal process. The virus is sort of out of the room by then. It doesn't live for more than 7 days. Actually, significantly less than that. So the proximity to the exposure is something to think about. That's even more if you know somebody was in the room that had COVID-19. I'm not an expert on cleaning, but the hard surfaces you can clean off with whatever antiviral product you're using. There are a ton of them. The porous surfaces like upholstery, I would utilize your normal cleaning procedure. However you normally clean furniture, to the extent you clean it. I mean, the difference would be you probably don't clean your upholstered furniture on a regular basis. Maybe some of us don't ever clean it. You probably need to establish a regular cleaning regimen for your upholstered furniture. And Robert, can you comment on the supply chain?
Sure, Dr. McDeavitt, thank you. Actually, the cleaning supplies are just as hard to get as some of our critical personal protective equipment. And so we've actually added cleaning supplies to our PPE tracking. It is important to clean all hard surfaces. And as Dr. McDeavitt said, maybe not so often the soft surfaces. But if you're having trouble finding your normal cleaning supplies because they're just not available, they're on allocation or whatever, what we've done is we've actually gone to using alcohol-based cleaners that you can put together yourself. So if you don't have your normal Lysol cleaning or other wipes that you normally use, if you do have alcohol, you can actually put alcohol in, just normal rubbing alcohol in a spray bottle, dilute it a little bit, and use that. But it's not quite as critical as having a face mask, a face shield, personal protective equipment. And so if it's restricted or it's on allocation, you can't find it in your normal supply chain, try to use just alcohol-based cleaning.
Thank you, Robert. We've talked about the different symptoms and whether or not that keeps you in or out of the office. And there is a hot conversation, and there's no pun intended, about temperature checks for employees at the door. And versus kind of that self-reporting piece. And first of all, you have to be able to find a thermometer, which talk about supply chain, that can be an issue. Maybe I'll put it in the context at Baylor, how are you guys doing that as far as temperature checking versus self-reporting?
Yeah, so it's evolved a little bit. So currently at Baylor, we've got people posted at every door. They ask about the symptoms. The symptoms are posted in writing at each door. Have you had any of these things in the past 24 hours? Yes or no? And then we have a infrared thermometer that people get shot in the forehead to make sure they're afebrile. So we're checking everybody who walks into our buildings, employees or vendors or anybody else coming into our building today. We are going within a week or so have an app in place that people will be able to self-attest to the symptoms. They can do that as a walking into work to speed up the process a little bit. And they can put their temperature down, but they're still going to shoot the temperature as part of the entry process to the building.
Got it. Got it. You know, if an employee's spouse, significant other, family member tests positive, and I'm looking at your looking at your grid on page 9. Maybe you pull that back up, Jim. That'd be helpful. There's a lot of information on that, and you know, I would say when we went through this deck, I think slide 9 might have been my favorite slide because it takes about 10 pages of CDC guidance and boils it down into one of do this, not that. So for someone who's been in close contact in the last 14 days, assuming a spouse would count as that, does that knock that person out for, I guess, that entire quarantine period? What should the policy, or as companies are thinking about policies, what should they be considering there?
Yeah, so again, we have chosen, and this we've changed as the epidemic has changed. This is probably the most conservative standpoint, would be to say that I've had close contact. I'm living with someone who has tested positive for the virus. Well, there's a pretty good chance, it's contagious enough, there's a pretty good chance that you also are going to have the virus. So we've made a decision that for those close contacts, that yes, you're going to be tested. For casual contact, no. The fact that I know somebody that had the virus and I've had very distant contact with them, I passed them in the hallway. Again, it's a little bit of a judgment call about what you consider a close contact. But to protect your workforce, and sort of a moral issue to this in terms of wanting to keep people safe, there's also sort of a business perspective that you want to keep people healthy so they can continue to work. So to the extent that you can keep sick people out and not have it spread through your workforce, that's a really important business priority as well. An important point to make is contacts of contacts, you don't need to quarantine. So if I spend time with my wife and my wife is exposed to somebody who tests positive for COVID-19 that I don't see, then I don't need to be quarantined, and that's consistent with CDC guidelines.
Sure. So you talked there about contacts. You know, the two issues that come up a lot are the testing piece, but then the contact tracing piece. And I know governments at all levels are thinking about what that means. You know, any advice, and again, maybe put it in the context of Baylor. You know, should companies be thinking about policies or at least advising employees on how they keep track of who they come into contact with in case they do, you know, test positive or somebody in their network does? How should companies think about that?
Well, you just asked a lot of questions in a short sentence. I mean, for one thing, in terms of your employees, you have some control of your employees at work. You don't really control what happens, nor should you, once they leave work. I do think you can offer strong encouragement and education to people at work. Why is it important to, and you don't do really good social distancing at work and then throw it out the window as soon as you walk out the front door. We should be committed as a community, for the benefit of our community, to doing this as rigorously as we can all the time, just not when we're in a certain environment. So I think there's probably a role the business community can play in helping to control this thing by doing effective education for people and making sure people realize it's a priority and take it seriously. So that's, gosh, I rambled about something. I forgot what the question you started asking me now. It started as a different question. How did you start that, your last question?
It was, let me go back in the chat. Actually, I think you got pretty close to the answer of where we were.
I guess the other question I thought you were going to ask is, well, here we are being kind of intrusive with people's personal business, and they come into our workplace, and we're asking them to disclose stuff that at some levels none of our business. And again, huge disclaimer: not a lawyer, don't understand employment law like I probably should, but. In a pandemia, in a public health situation, it's my understanding you do have the right to screen your employees effectively to keep your environment safe. So if we had a TB outbreak, you could require that your employees all got TB tested to be eligible to work. So I again, don't take me as a legal scholar, but I think you are perfectly within your rights to make it a requirement of your employees to disclose that information to remain as an on-site employee with your organization.
Right, right. One question, and this is taking out of, I would say, a traditional business setting, but kind of a broader setting that a lot of people come in contact with, thinking about houses of worship. And I know that the state has guidelines and CDC has put out guidelines, but broadly, if you were in that type of environment or, a minister or something like that that's thinking about reopening, what are kind of some of the top line things that those facilities and organizations should be thinking about?
I'm really happy you asked that question because it's sort of by analogy. When you talk about what I do as a business, a lot of the doctors in our organization recoil and say, "Well, it's not a business. We take care of patients." I imagine the clergy on the phone, they probably feel sort of the same way. If we say you're in the business of saving souls, it's not really a business. It's a mission. It's a ministry. But having said that, I think it's the same common sense approach to walk through and think through exposures. So in a church, and frankly, I haven't seen a lot of this in Houston, to the extent that you can actually post in the front of the church alcohol, hand sanitizer, and encourage people to sanitize their hands as they come in, I think would be appropriate and a good step. To think about social distancing in the pews. And again, a lot of funny memes out there about social distancing. There's the one where they've got the 3 ATMs right next to each other and lines 6 feet away from the ATM, so everybody's queued up appropriately, but everybody in line is standing shoulder to shoulder. And the meme is that it's a good thing the virus can't travel horizontally. Well, you have to think it at least 2 dimensions as you're doing this thing and think about 6 feet around people. Think about pews. How can you space people out? Do you have families sitting together, or do people actually sit 6 feet apart? And you can make an argument that families should sit together. You could also make an argument that nuance is a little hard to communicate to people, and you're safer if they're actually separated. But to think about what you can accommodate, block up every other row of the pew, I think is important. And then controlling who comes into the church or synagogue or place of worship. Now, I don't think you'd be successful saying, well, let's put symptom checkers out front and we'll have everybody attest and shoot their temperature before they come into church. I guess you could, but it probably is appropriate to put a sign out front to say, please, if you have these things, if you've had a temperature, please don't come into church. So try to control the people that are coming in. And then I think churches are kind of like businesses are in a way, uniquely positioned where you're bringing in a really interesting cross-section of Houstonians and recognize, along with saving souls, you've got a great opportunity to provide an educational function to our community and get good information out to people about how they should be managing and they should be masking and the importance of social distancing. I think that's an important role that churches could play.
Right. Well, we'll take a couple more questions here. And this one, there's some details in this a bit, but thinking about an office environment, you obviously have offices with doors, and then you have cubicle areas. So if we work in a cubicle area and the desk chairs are appropriately distanced, so 2 people could be sitting there. But you think about sometimes you talk about traffic and flowing. It may put you in the flow of being less than 6 feet, maybe say 4 feet apart. Should companies where you do have those kind of constrictions, should they be thinking about, how to better disperse the employee base across an office space? Is that really a concern as they walk by? What should they be thinking about as far as office layout and seating arrangements?
Yeah, again, it's all been good questions. That's another good question. So think about where the 6 foot comes from. And those of you that can think way back to a month and a half ago, we were talking about 3 feet instead of 6 feet, and then went to 6 feet. Well, that number comes from when you cough or you sneeze, the likelihood that you can propel a particle of an aerosolized droplet across space to infect somebody else. That's the distance that the droplet will travel. And conceptually, it is not that you are surrounded by a fog of viral particles 6 feet in every direction. You're going to propel it out of your mouth and nose. So if you think about it that way, casual moving through somebody else's workspace, particularly if you're masked, is probably completely safe and very, very low risk. On the other hand, if you're running a call center where you have people sitting at cubicles and they are shoulder to shoulder and they're 3 feet apart, then you probably should look at reconfiguring that space. So again, it has to do with closeness and duration of contact. Everybody should sort of have 6 feet around them, but casually moving through that space is absolutely fine. Keeping people in close proximity, closer than 6 feet for an extended period of time, you probably need to look at re-engineering your space.
Sure. So maybe one or two more, and this is kind of the broad question. You know, you are a medical expert. You've been, I would say, doing this specifically your entire career, but thinking about you know, these types of environments and these questions. You know, as we do start the process of reopening, you know, as a medical expert, what keeps you up at night? Like, what's your biggest worry as you think about, as we kind of I'd say break the dam a little bit?
It's a couple of really big worries, and it's changed over the past 2 months. I can tell you that, I mean, part of my worry is the same worry everybody in this call has. We have plummeting revenues and expenses that don't go away, and how do you just maintain your business and stay viable? That's a general concern everybody has. From a healthcare provider's perspective, my biggest fear, and actually maybe terror, was that we would become Lombardy, Italy, or New York City, that we would be in a situation where we had more patients than we had the ability to put a patient on a ventilator. And you read stories in Lombardy about a doctor standing over 3 patients, all of whom needed a mechanical ventilator, and he only had 1 ventilator. So some real fear about outstripping our medical supply. Or my daughter happens to be a psychiatry resident. There are stories out in New York. There was one in the New York Times last weekend, I think, of a psychiatry resident that was forced to work as an intensive care unit physician, managing patients' ventilators, and feeling incredibly guilty and anxious about providing care that she didn't feel like she was qualified to prepare. So a lot of our work at Baylor was geared towards thinking about a surge that fortunately didn't happen. And really grateful that didn't happen, and hats off to Houston. The reason it did not happen is because we did a good job with social distancing. That is factually, that is why it didn't happen. So you ask what my biggest current fear is. My biggest current fear is still that we're not out of the woods. That this is our first experience in the United States with a pandemic of this scale. And the analogy I used is that this is very much like if you're trying to start a fire in the woods and you've got a bunch of dry sticks. Well, the sticks are all dry, and you light one, they all spontaneously ignite really quickly. Well, all social distancing does is spread the sticks out on the forest floor so they don't catch each other on fire. As soon as you push them back together again, they'll reignite. Now, as we have herd immunity, as we have a vaccine, then suddenly you're pushing together people that are immune. You're pushing together green sticks and damp sticks, and they don't spontaneously ignite. But it's going to take us months to get to that point. So we need to figure out a way to do business in Houston and do business effectively while sustaining our social distancing. Because if we don't, my biggest fear is we have another surge, we end up like Wuhan or Lombardy or New York, which is still I don't think a 90% possibility, but I think it's still probably a 5 to 10% possibility in my mind.
Well, thank you, Dr. McDeavitt. I mean, this has been great. You know, as business leaders, owners, I think what he's underscored here is that we have a responsibility to get this right, both for our employees and for our customers. And if we can do this right, we hopefully will not have to go back on restrictions, because that's the last thing any business leader wants to happen. And so we do appreciate this advice today. We do have a few questions left in the queue, so we'll stick around for a bit to answer those via text chat. Carrie, do you have any closing business that we need to take care of?
Thanks, Clint, Dr. McDeavitt, appreciate that. At this point, no, we would just like to share with our audience that we do have several events coming up. They include our economic update with Patrick Jankowski next week. So many of you have participated in Patrick's presentations bi-weekly. So join us again on Tuesday for another economic update. And I've left our events website up here, so you can visit that regularly, where we have updates on all of our programming. We do try to have our COVID-19 workshops on Tuesdays and Thursdays, but lots of other business events and networking activities as well. While you are departing, I will leave this slide up, houston.org/coronavirus. You can get all of our information here, all of our web content that's been recorded, as well as the link to today's presentation. It was a wonderful presentation. Thank you again, Dr. McDeavitt. So we will leave this up, and thank you for joining us today.
Thanks, Carrie. Thank you, Jim.
Thank you. Thanks for having me.